All right, it is time to go ahead and get the young ones out of the room because we're going to be talking about some adult things right now. We're actually talking about how Botox can help your sex life. Joining us this morning, Dr. Irwin Goldstein from San Diego Sexual Medicine Alvarado Hospital. He is here along with Mary, who uses this treatment. Thank you both for being here. We appreciate it.
Okay, thank you always for doing this, and happy holidays.
You too. Back at you. Okay, so talk to me about this. Botox has been used for quite some time in the face and other areas, but now we're talking about using it to help improve our sex life. And it's not, I understand, FDA approved for that use just yet. So how is this being used?
We'll take 2 steps backwards. It stops nerve impulses from reaching injected muscles. So the traditional 12 million people, 4% of our world in the United States, have received injections in the face, in the globellar area, crow's nest areas, and the wrinkle lines. And if you can't contract those muscles, then you don't get wrinkles and people are happier about the way they look. But there are many medical conditions where the muscle is too overactive. Migraine in the neck muscles, throat areas where they can't speak, bladder where you urinate too often. And in sexuality, the muscles around the area where sex is happening can be too tight. So we use it to do that, and Mary is a perfect example.
And so you're actually getting injections.
Yeah, it hurts a little bit, and Mary will tell us, but
well worth it.
Well worth it. Mary, tell me a little bit why this was something that you wanted to try out.
Okay, well, a little bit about my story. I had a condition called vulvar vestibulitis for over 20 years. Various times it would get better, it would get worse. After the birth of my second child, it just was so bad I basically couldn't have any relations at all. A lot of doctors had tried different things with me, various creams, was not getting better. I luckily found Dr. Goldstein. He found a hormonal imbalance that I'd had that no other doctor had found. Also, I was a modern and ballet dancer. And from that, I also had a really, really tight pelvic floor. So he balanced my hormones. I had surgery, but I still wasn't out of pain completely. Did a lot of physical therapy, but my muscles were in spasm and so used to being tight that I'd have the physical therapy, but it would just go right back. And it was quite a frustrating situation. So he did Botox, and it was just a miracle treatment. Within, I would say, 48 hours, I had no pain whatsoever.
Really?
Yeah, and this is a long time of suffering. So.
And how many injections would you say you got? Do you remember?
Well, it was about 8 needle sticks.
Okay.
But again...
I have Botox.
Yeah.
And I have the needles.
Okay.
Okay, so that's what it looks like. It's not pain-free. But if your muscles are interfering with your world, it's an option, basically.
Okay.
Yeah.
And you just had 1 round done, and you say it's lasted.
It lasted. I mean, I definitely saw, you know, the benefit for the first 4 to 6 months, but it's had a lasting benefit for me because I think it really interrupted the muscle spasm itself, and then I was able, with some physical therapy and other things, to work with it then and fully relax the muscles.
And you noticed that in 2 days, you say?
In 48 hours.
Wow.
Yeah, huge difference.
And is Mary's experience typical?
Mary's experience is typical. The issue is a lot of women who have pain issues or sexual issues in general, either they see physicians who don't know how to manage it or don't deal with it at all and just hide it and just grin and bear. So I think the message we'd always love to give, especially at holiday season, is if this is a big problem in your life, your relationship is important, intimacy is important, get help. And Mary's an example of somebody who...
I mean, Dr. Goldstein changed my life.
Right.
20 years of seeing renowned doctors in Southern California, in Northern California, and, you know, I just don't want anyone to suffer like I did. Yeah. So, you know, my message really is if anyone out there has sexual pain or dysfunction, they've been with their doctor maybe 6 months and it hasn't been eradicated or significantly improved, to contact Dr. Goldstein. He gives a free 15-minute conversation, and my first 5 minutes of speaking with him, I knew he had the answer, and it was something, what he told me was what no other doctor had ever told me.
Real quickly, who is not a good candidate for something like that? Can you tell me that? And then also, what are we looking at cost-wise? It probably depends on how many injections you get, but what are we talking about price?
So it comes by the 100 units.
Okay.
It's about $10 to $15 per unit. So like a face is about 60 units, so it's about $750.
Oh.
So for what we do 200 units.
Okay.
So it's reasonably expensive.
Gotcha.
if the muscles are getting into spasm from another reason and the muscles are secondary to that reason, you have to deal with the primary reason. That's why she had surgery. But after surgery, she had no reason for the muscles to be in spasm. So the Botox unraveled the spasm, and now she's home free, basically.
How many of your patients are getting this kind of treatment? What percentage would you say?
So it's typically, I don't know, 2 or 3% of patients are Botox candidates. I just want to mention one other thing.
Sure.
Since Botox relaxes muscles, there are men who have a problem of early ejaculation, where their muscles are, the ejaculation muscles are squeezing. We're now putting Botox in the ejaculation muscle, so they can now prolong their sexual activity.
You're kidding.
Fabulous thing. It's experimental, and we have a clinical study going on using Botox for early ejaculation. So listen, we'll do anything we can to help people with sexual problems.
Real quickly, side effects. What kind of side effects can you expect?
It's pain to inject, but
Yeah.
what did you experience, Mary?
Nothing.
Nothing.
I mean,
Okay.
it was quite painful to start, and I know you're doing other things where sometimes you can put people under, perhaps.
Yeah, we're putting people to sleep to put it in, and the hospital, we call it examination under anesthesia, so it can be covered that way.
Okay.
I did it cold turkey, old-fashioned
You
style.
did.
But it was well worth
Tough
it.
woman, I like
That's
it.
right.
Okay, very good. Thank you both for this.
thank
This is
you,
really
Erica.
fascinating stuff. Thank you for sharing your story, Mary. We really appreciate it. If you want to get in touch with Dr. Goldstein at San Diego Sexual Medicine at Alvarado Hospital, all you have to do is go to our website. It's fox5sandiego.com.